I guess all of you have relatives around you who have suffered from stone pain. It is considered one of the most painful processes. So why these stones? Urolithiasis or stone disease in its simplest terms. Substances such as calcium and oxalate combine to crystallize and form stones. These stones cause problems such as destruction, obstruction, and pain, especially in our urinary system. Now, let's look at the factors that increase and disease stone formation. Menopause. The incidence of stones increases after menopause. This is due to decreased estrogen. Hot climates. The incidence of stones increases in hot regions. This is because our bodies are more dehydrated in hot regions. Our urine becomes more concentrated and the risk increases. Nutrition. Protein-rich diet and excessive salt consumption increase stone formation. Proteins act by reducing the amount of citrate, which acts as a protective agent in stone formation. For example, in Sweden, which is very fat with fish, incidence of stone is high. Salts increase crystallization. In addition, fibrous foods reduce stone formation. Infection and blockages also increase the susceptibility to stones. Factors such as heredity, gender, age, geography, occupation also affect stone formation. The most important substance that reduces stone formation is citrate. Citrate acts by preventing the combination of calcium and oxalate. And one of the most common foods is lemon. It is also found in parsley. Did you know about kidney stones in our body? Don't forget to write your experience in the comments.